Hello, so right now I'm going to be going over with you how to do the treatment planning phase of ODTP. So as a friendly reminder, the ODTP treatment plan should be divided up into 4 different categories. You have your urgent phase, which pretty much is anything that's related to pain, so typically extractions or root canal therapy. Then you have your disease phase, which is usually your perio and your caries. Then you have your restorative phase, which is usually anything related to restorative work. So your kind of direct, indirect restorations. And then you have the maintenance phase, which is usually things such as night guards, maybe some rinses, maybe an ITE, whatever that patient may need. So how do you do it? You click treatment plans, you click on the plus icon. Now you want to put in your ideal treatment plan for this patient. So say I'll name it ideal plan, and in chief concern, in parentheses, say I'm interested in a cleaning. So you want to write down everything that this patient has. So let's just do a hypothetical. So say for urgent, looking at this patient, we see number 31 is broken at the gum line, patient is in pain. Okay, so you want to extract that tooth. So we want to put first a diagnosis, so such as non-restorable carious tooth. That could work. Then you would click on new item, non-restorable carious tooth, and then you want to extract it. So the code for extraction is 7140. Okay, click on it. Put it as tooth number 31, for example, in this scenario. And it's phase 1, sequence 1. So phase 1 means it's part of your urgent phase. Sequence 1 means it's the first part of your urgent phase. Okay? So here we've decided that, okay, this is the most important thing that we're doing. So other things that could go in there are pretty much always is extraction or root canals that are causing pain. Okay? After that, you will most likely move on to perio. So we'll put in the diagnosis of this patient. Say, for example, generalized mild chronic periodontitis. Is that gonna, let me go back here one more time. You want to make sure it's one of the codes the system actually has. So generalized slight is what they're using. Okay, and say, for example, in this case, we want to do 4 quads of scaling and root planing. So here we see D4341 is scaling and root planing. D4342 is scaling or root planing when there's less than 3 teeth that need to be scaled and root planed. So let's do this one, for example. Say that means just the posterior teeth and all 4 quads need to be root planed. So we click that. Then we're going to put this as phase 2, right? Because now we're in our disease. And step 1. And we're going to do all 4 quadrants. So now all 4 quadrants have been incorporated into our scaling and root planing. So at this point, also remember, if you've done scaling and root planing, you also need to put in an ITE, which typically would go in your maintenance phase. But we should just put it in now. So same generalized slight chronic periodontitis. Then the code for ITE is D0180P. So you see, ITE, comprehensive perio eval. And this already is step phase 4, so maintenance. And you'll get differing opinions on where to put the ITE. Some faculty will say that should stay in the disease phase. Some will say that can go in the maintenance phase. But I think the key thing here is to make sure you have it on the treatment plan, because 4 to 6 weeks after the appointment, it's going to be important that you reevaluate the patient. So what else does this patient have? Looking at the odontogram, we also see that there are some carious lesions. So we see a 3 occlusal, a 13 occlusal, 19 occlusal. So these are all caries. So let's say hypothetically that the caries on tooth number 3 is actually really large and it needs a buildup. So we're going to put dentin. This is the most common diagnosis you'll put, caries of dentin. So we decided that tooth number 3 needs a crown. So we would go in, we put caries of dentin, and at UOP we always put build up first. So you put build up, of, that's D2950, 3. This is already in our still disease phase, so phase 2, but the second thing that you would do after the scaling and root planing. So we have our buildup in. Now don't forget the crown is part of the restorative phase. The disease has been taken care of by the buildup. So we continue to put in everything else that we need. We have our number 3 buildup. We see 19 and 20 have occlusal composites. Let's say those can just be redone. So very simple with composite. You put in COMP, and then you kind of see all your options. So in this case, we know 19 occlusal, so we see posterior, 1 surface. And we do 19 occlusal. You know your surfaces, MODBL. Phase 2, part 2. No, at this point, part 3. So we got that in. Then we want to do the same thing we're saying for tooth number 20, for example. Or let's say this one's a MOD, just to change things up. So you would click D2393, okay? And we move on to tooth number 20, MOD. Number phase 2, restorative, sequence 4. Now looking at this, actually there's a change that I would make in my treatment plan. Whenever you treatment plan a UOP, we like to go from largest carious lesion to smallest. So tooth number 3, the buildup is first. Now the next one though, in this case, should actually be my MOD composite because it's significantly larger than the 19 occlusal. So we don't usually in the main clinic go by quadrant, we go by the size of the carious lesion. Okay, so at this time, so what do we have so far? We have our patient was in pain from tooth number 31. That's going to be extracted. We have our scaling and root planing, the beginning of a disease phase. Then we have our buildup, our 2 composites that this patient need, and we have the ITE. So now we also have to put in the crown. So open it up. It still caries of dentin. And now crown, there's a number of different codes for crown. So I would actually click on the little asterisks. Full list. But for single unit crowns, you click on restorative. Then you click on crowns, single unit restoration. And at UOP, we pretty much narrowed it down to 3 options. You have porcelain ceramic substrate. That's what we most commonly use. That's lithium disilicate or zirconia crowns. Then we have our PFM. We use noble metal. So we can either do the PFM, noble metal, or more commonly is the porcelain ceramic substrate. The other one that we sometimes do is gold. And that one is going to be our full cast noble metal. Okay, so those are your kind of 3 options. In this day, most of the time you're going with the porcelain ceramic substrate. So we click on that one, we put in tooth number 3, and now this is the first stage of our restorative phase. So we put in number 3, the first stage, click complete, and you're always going to want to add in this lab code. So you just click add, and it auto adds for you. So here we've kind of completed a pretty good treatment plan for your patient. As you can see, it's went down from urgent phase, disease, restorative, maintenance. We've put in everything in its proper order, and we're ready to go. So let me just show you a few other kind of codes that might be relevant to you as you start out. So new item. Let's just put in caries, and then click on the asterisk here. So, and full list is always the easiest way to go. So a few other things that might be important to you might be x-rays, right? So as you can see here, you can click on radiographs and find whichever ones you need. Intraoral complete series, your PA, they're pretty self-explanatory. You just click on the one that you need. Other common ones also would be from the Canberra project. So any of your fluoride rinses, chlorhexidine, maintenance rinse, whatever you may want is right here under the Canberra project. And typically we would put that in stage 4. Under preventative, if you're just trying to do a dental prophy, it's right here. Also fluoride, but not as common. Restorative, your most common one, right? So your composite codes, your amalgam codes. We don't do gold foil anymore. Your inlays and onlays, and your crowns, very common. The other one is endo. So very simple. Click on endo. Endotherapy is usually what you'll be doing, and you click on the tooth that's going on. So the key here is, for example, if it's anterior tooth, you would click D3310. If it's going to be done by the UOP residency clinic, click 3310R. Okay, so the R stands for resident, and there's a different fee code for that. Endo retreatment is right under that, and the other ones are a bit more complicated. We don't usually use them. Periodontics, this is mostly surgical periodontics, so not something we typically touch. But if, say, you need a gingivectomy or something like that after your perio consult, you can ask your periodontist and they'll tell you the code that you need a treatment plan. Removable prosthetics, critical to your third year at UOP. So here are your complete dentures. Be sure you click on the, we don't use the metal one, so it's the regular complete denture. Then your partial denture, very important. Cast metal is the partial denture we use. Resin-based is a plastic one, so we don't actually make those. You can also find your relines, repairs in here. Fixed prosthodontics is where your implants are, which these codes, when you do your implant consult, they always help you fill in because we typically just don't know what all the bone grafting and such is. But fixed here is very important for your bridges. So if you're doing a bridge, you want to go to FPD retainer. Those are your two abutments. So if you're doing porcelain ceramic, you would click 6740 and you would treatment plan. So say if we're doing an 18 through 20 bridge with 19 missing, you would put 18 and 20 as porcelain ceramic, and then for 19, you would click Pontic and click on whatever you may want. So porcelain ceramic. Okay? So that's how you treatment plan a bridge. So it's not the same codes as a crown. You go to fixed prosthodontics and click the retainer. Surgery, this is your OS cases. I mean, most of the time we're just talking about regular extraction, 7140, or surgical extraction, 7210. Once again, all the more complicated ones you'll get help with. Ortho, we don't typically do in the clinic, and same goes with miscellaneous. So I hope that was helpful. That's in general how you treatment plan. I think the key here, whenever you're in the clinic and it's time to treatment plan, just break it down into your phases. Urgent, disease, restorative, maintenance. As long as you do that, you can't go wrong. Good luck.